Today we talk everything flexion intolerance, what this means for you, why it might have happened, and some potential solutions. First off, what is flexion intolerance? It is when the motion of rounding the spine, flexing the spine over, irritates your lower back. This could come in the form of muscle tightness around the lower back. It could be pain in the hamstrings, the glutes. You could have some neurological symptoms, sharp pain in the lower back, dull pain in the lower back. There is a lot of different presentations of dysfunction because there's a lot of different reasons that it could be happening. It could be discogenic, vertebral, joint, muscular. There is a ton of different things. However, if you are presenting with neurological symptoms as well, it is kind of leaning more towards that discogenic, maybe vertebral kind of issue. However, it doesn't mean that's a 100%. And it doesn't mean that that is the end of the world. What it does mean is that we are probably overworking some of the tissues associated with the lower back and not allowing them enough time to recover or adapt. Let's break this down. What we know is that the motion of flexion irritates your lower back. So what during the day can we change or alter to maybe not wear the tissues down so much throughout the day and allow more time for recovery? Some examples of common stressors are things like prolonged sitting without getting up to give the back a break, slouching a ton while we're at work, things like bending. Bending over can be a big one, again, especially under load. So if we're picking up heavy stuff throughout the day and we are allowing our back to really do all the drive of the object off the ground, that's gonna put a lot of stress on the back. And again, picking up something heavy off the ground with a flexed spine isn't the end of the world. However, if you're doing it consistently, combined with a ton of other things, like again, we have sports, hobbies, all these things can potentially wear down the back depending on how you move during these particular activities, and that can lead to the injury. And while those movements aren't inherently bad and there's not likely one sole cause, the nature of flexion intolerance suggests that we are overdoing it. And once we understand this, we can start to implement more spine-friendly variations of movements into our day so that we can raise our tolerance and ultimately start building our exercise program around those postural goals that we're trying to achieve. For instance, if you wanted to feel more supported while you go into a bending position, you can incorporate exercises that focus on the abdominal brace, that focus on hinging from the hips. Another example could be if your job requires a lot of twisting, we can do movements that are anti-twist that also focus on the stability of the hips. These could be stuff like wood chopper variations, the Palloff variations, oblique plank. These are all great exercises for getting the hips and the core to work together to support the spine, and that can help as well. If you want a few more examples, check out the description. I also posted in there a few videos that pertain to what we talked about today, so go check it out.